afternoon, everybody. Good afternoon. Uh, Welcome to our all recovery meeting. My name is Craig, and I am your recovery coach on today. And so, as I'm preparing to get started, I just want to make sure everything's in order for those who may be joining or those who may be watching. Yes, this is our mentoring support group, and today we're going to be talking about, place it on the screen so everyone can watch. And today we're going to be talking about that is, men and mental health stigma. Men and mental health stigma. This article is brought to you by addictioncenter.com, and let's get right into it. Okay, let's get directly into it and see what the article can inform us more about men and mental health stigma. And so, men's mental health, why stigma silences so many men. All right, it's a very important topic because a lot of men, we may have a predisposition or predisposed condition that we don't need to see some professional help, and that we can figure it out on our own. It's a sad mistake, and that's why they have professional people who go to school, and that's why so much study is being done to dispel that myth. And so let's see what the article says. It says the month of May is Mental Health Awareness Month. I forgot to mention that. Yes, it is. The month of May is Mental Health Awareness Month. And while the open disclosure of mental health has changed drastically over the past decade, there is still a distinct disconnect between men and mental health. The problem goes well beyond the misconception that men don't want to express their emotions. Barriers like stigma, masculine norms, and societal factors directly impact the way men think about, approach, and treat their mental health. Although all genders are affected by mental illness, it is often overlooked in men as they are less likely in comparison to women to speak of, or seek help for their mental health. This is an alarming in context to the statistic that in high-income countries, 3 times as many men as women died by suicide in the year of 2018. According to the World Health Organization report, these barriers that men often face when addressing and treating mental illness are nothing new. However, expanding conversation on why such barriers exist can bring awareness to the issue and help alleviate the feelings of shame or otherwise that many men face regarding mental health. Okay, and so we need to address that because the article says there are too many of us men who are suffering, and there are help out there for us, and so we need to get the word out and dispel that myth about or stigma about mental health. And so the article wants us to be informed about men's mental health statistics. It says, according to Mental Health America, MHA, there are 5 primary mental illnesses that men in the U.S. face, including depression, anxiety, psychosis, and schizophrenia, bipolar disorder, and eating disorders. Okay, there are 5. It says 6 million in the U.S. today. Over 6 million men suffer from depression each year. Over 6 million. That's alarming. 3 million more than 19 million adults ages 18 to 54 have an anxiety disorder, with over 3 million men having either an anxiety disorder, uh, agoraphobia, or another phobia. Then it says 90% of those diagnosed with schizophrenia by the age 30 are men. All right. What is stigma? Let's talk about it. See what the article says. What is stigma? It says, in theory, addressing one's mental health with others should be similar to discussing a broken bone or any other physical ailment. But stigma silences so many men. It should be a common conversation. It should be an open conversation without any shame or guilt. It should be talked about where it comes from. How can we treat it, and how can we help others who may be suffering in silence? And so it should be the norm. And so there's so much help out here today. And it's our part as healthcare providers in whatever capacity we work. I am a recovery coach, so therefore I'm not qualified to give anyone sound assessment or diagnosis. Only thing I am able to do is to assist you with some type of information and also referral-based references. Okay? And so the article goes on to say, stigma not only bars men from speaking to their loved ones about mental illness, but also from addressing it themselves or seeking help. Okay? Several types of stigma affect men's relationship with mental health, including, here they are, social stigma, right? Self-stigma, professional stigma, and cultural stigma. Wow. You know, we have this thing about us as men. We have this role that we are the head, we are the leaders, and that we have to provide and protect within our culture, within our families. We have to be strong. So we have this strong concept within our mind. And so, but my thing is, if we're not healthy, then all of that goes out the window. If we're not being diagnosed effectively with the professional help, we're not receiving the right medication, the right information, then all of those things that we say as men that we stand for and that we are willing to provide, whether it be our family, our home, our community, without the proper help, we're really doing a disservice to all of those entities that I just mentioned. All right? And so it says the next one we want to talk about. So there are some other stigmas that's here, and that is social stigma. Social stigma refers to the negative attitudes or stereotypes directed toward a person or group experiencing mental illness. An example of this would be negative attitude that those who have depression are weak. Okay? Okay. This external form of stigma is rooted in the misconception that mental illness represents a person's character. This misconception leads to discrimination, avoidance, and rejection of a person experiencing a mental illness. The next one we want to talk about self-stigma. I believe this is something that we place on ourselves. Self-stigma, also known as perceived stigma, is an internal form of stigmatization that one imposes on themselves. An individual experiencing self-stigma will internalize the negative views and opinions of mental illnesses. which leads to judgment and shame about one's symptoms. Then there's another one, professional stigma. Professional stigma occurs when healthcare professionals perpetuate stigmatization toward their patients through negative attitudes. These attitudes are often based on fear or misunderstandings of the causes and symptoms of mental illness. Additionally, professionals themselves can experience stigma from the public or other healthcare professionals because of their work and connection with individuals experiencing mental illness. And the other stigma that the article made mention of is cultural stigma. Cultural stigma involves how an individual culture interprets mental illness. Culture shapes one's beliefs, values, and norms, and it directly relates to how people attribute meaning to certain illnesses. Culture also affects whether people seek help, what type of help they seek, and their coping style and support. And so these are some descriptive categories that deals with or that define where these stigmas are located and how we place them on ourselves and how society place the stigma on people like myself as well. And so there's social stigma, there's self-stigma, professional stigma, and cultural stigmas that the article make mention of. And so we want to move right along and get into this one. Remember, this is a mentorship of men. And so this is what we call our MIT, Men in Training. So that's why you hear so much about men being discussed on today's support group, because this is what it is, a men's group. And so it says men, we're talking about men and mental health stigma. This is our mentorship support group. And so the next one, we want to talk about masculine norms shape discussions on mental illness. Masculine norms shape discussions on mental illness. Another barrier for men facing mental health issues is the indoctrination of masculine norms in U.S. culture and society. Masculine norms are the social rules and expected behavior associated with men and manhood within a given culture. The phrases toughen up, man up, men don't cry, etc. Perpetuate the idea that men are not supposed to express sadness, grief, or pain, and to do so is the ultimate sign of weakness or femininity, at times considered one of the same. These masculinity standards contribute to men not seeking professional help for their mental health and fear of their masculinity being diminished. Moreover, men are less likely to seek treatment than women due to downplaying their symptoms, a result of self-stigma and a reluctance to talk about their mental health. Men, we need to open up a little bit. I was reading this book. Basically, it was a book talked about emotional incarceration and how we as men we basically are holding on to a lot of things bottled up inside, such as our emotions, and so we have this fear of letting it out and be set free. And so I like what this article really talks about, how men begin to put self-stigma on themselves and not reluctant to express themselves with maybe another man or a professional person. So we need to get over that hurdle. So basically, that's what I'm saying. We as men, we need to begin to see some healing in the right way. And so That's just some encouragement for some men. Do not be afraid to seek help. And if I'm here, if I can help you in any capacity, I'm more than willing to assist in that area as well. Men in America and throughout many cultures are often not taught or socialized to discuss their emotions or troubles. If anything, it is discouraged. In contrast, most women are taught how and in what way to express themselves, while most men are left out of the conversation entirely. In context to men's mental health, this lack of emotional acceptance leaves many in the dark, unable to speak of their troubles, and some are even unable to name them to themselves. Wow. We have to be able to identify what's going on. Okay? In order to treat something, you must be able to identify what caused, what are the root causes of the problem. All right? So let's move on. We don't want to get stuck in one area. We want to get as much information out on today as possible. Now, let's talk about specific barriers for men of color and mental health. All right? And so the article says beyond stigma and masculine norms, men of color face additional challenges and risk factors that have historically affected their mental health and how they approach it. Risk factors that affect men of color include higher exposure to poverty and violence, absence of economic opportunity, and higher incarceration rates. The result is a compounding hit on mental health between the stigmatization of all men seeking help and unique stressors. Men of color are at higher risk for isolation and mental illness. However, this higher risk does not correlate to higher treatment admission rates. In a recent study by the Center for Disease Control and Prevention, CDC, only 29.4% of Hispanic and non-Hispanic Black men went in for mental health treatments compared to 45.6% of non-Hispanic white men. Another significant barrier for many men of color is cultural stigma and mistrust of the healthcare system. Historically speaking, documented racism and bias within the healthcare system have led some Black people to be weary of seeking treatment. According to research by the National Library of Medicine and Dr. Neil Barnett, a leading expert on anxiety disorders among Black Americans, there is a collective mistrust of healthcare and medical providers among Black patients. This mistrust is linked to the abuse Black patients have historically experienced under the guise of medical testing and advancement, like in the case of the U.S. Public Health Service syphilis study at Tuskegee. Factor in the cultural stigma of Black masculinity norms that make it difficult for Black men to be vulnerable and express emotion. And it makes sense why it is difficult for many Black men to pursue professional help for their mental health. All right? And so I am a African American man here in the United States, and so there is I want to say pause. I don't want to say exactly put a label on it, but there is a heightened awareness or sensitivity to the approach to professional help. And so I'm not sure how people individually or collectively think. I can't speak for other people, but we need to really allow ourselves to receive some help, especially if our behaviors is demonstrating something of abnormalcy. So therefore, I encourage men, regardless of who you are, if you are struggling with some behavioral issues and you may feel that there may be some mental health issues going on, hey, Seek your loved ones, seek somebody, family member, seek someone that you can confide in, accountability partner, or you can even contact Capital Recovery Center. And then we can do the best that we can to encourage you to get healthy. All right? Let's talk about another one that we've been talking about all month long of May, and that is the last one I want to talk about and discuss and that is dual diagnosis among men. Dual diagnosis among men, mental health and substance abuse. That's a duality, okay? A dual diagnosis or co-occurring disorder is when an individual has one or more mental health disorders combined with a substance use disorder, CUD, sub. Often mental health disorders and substance use disorders concurrently occur because some struggling with a mental illness will use substances to self-medicate, and substance abuse can sharply increase or even trigger new symptoms related to a mental health disorder. Okay? While co-occurring disorder can affect anyone regardless of gender, certain substance use disorders are more prevalent among men. Okay? For example, the National Institute on Drug Abuse found that men are more likely than women to use almost all illicit or illegal drugs. Regarding alcohol use disorders, AUDs, 1 in 5 men will develop alcohol dependence during their lives. Another point of concern is since men are less likely than women to seek treatment for health concern and substance abuse, the presence of co-occurring disorders among men could potentially be underreported. All right? And so, like always, we're here to encourage you. We're here to share some pertinent information. We hope that if you watch this segment of mentorship, support group later on, please feel free to contact us. Let us know what we can do better, what you liked about it, what you didn't like. And once again, if you're just logging on, you can retrieve this information on your own, and that is addictioncenter.com. You can go to addictioncenter.com and grab the same material and educate yourself as well. All right? And so until the next time, I hope all is well, stay well, and continue to make strides. And to all the people out there who may be watching, May is Mental Health Awareness Month, all month long. Be supportive of someone, be sensitive to someone's situation. You never know who may be going through something in life. We all need someone at times to confide in for help. And so show some love to someone today. You never know what they're dealing with. All right, until next time, take care. My name is Craig.